morning, everybody. Welcome to our February edition of the Orthopedic Minute here at Memorial Hospital of Carbon County. My name is Bob Keel. I'm a physician assistant that works here in the orthopedic clinic. Today I'd like to discuss a little bit about arthritis, and more specifically arthritis of the knee. So typically as we get older, our joints wear down and they can hurt, they can cause pain. There's different types of arthritis. There's an arthritis where your body attacks the joints. That's a lot different than osteoarthritis. Osteoarthritis is that wear and tear. The signs and symptoms that you'll see if you have arthritis, typically it starts with a injury or something that happens when you're in your fourth and fifth decades of life that causes pain in a joint. One of the more common joints is the knee. Hips are another really common joint. Wrists and ankles also are very common for arthritis. And after you get that pain, it's sharp, it hurts, but when you relax, it usually goes away. It does mildly affect your function. And then you get treatment, and that treatment can help it go away. When you start to get a more moderate or severe form of arthritis, it's a dull achiness that's in the joint that makes you feel maybe a little unsteady, unstable, maybe a little weak. And it affects usually everything you do during the day. For example, in the knee, the typical patient that will come in with knee arthritis will say, my knee just aches all the time, but it's worse in the morning. It gets a little bit better after I warm it up. And then at the end of the day, it's really bad, but when I lay down and put it up or I take ibuprofen, it will feel a lot better. And so today I'd like to discuss the different stages of arthritis and where it affects the knee joint. And so I have this card right here. I'd like to illustrate the white spots on this card are cartilage. It's kind of like a hard rubbery substance that's a cushion that protects the actual bone itself. And as we move around and we get older, what happens is part of that cartilage wears away. And it can be really mild in some cases, or it could be really severe in some cases. And typically we treat the patient's symptoms and not necessarily the amount of arthritis they have. And the reasoning behind that is sometimes I'll get a patient that comes in, they hurt a lot and they're in a lot of pain. I do an x-ray and they have mild arthritis, but that mild arthritis happens to cause them a lot of pain. And so we treat that pain, whereas I could have somebody come in with very severe arthritis, but very little pain. And so if they're not in that much pain, I'm not going to treat it. I'm not going to introduce them to medications or injections if I don't have to. So typically, if you have pain and symptoms, and I can associate it with an arthritic change in your knee, then we decide to go ahead and treat it. Typically, the treatments start with very less invasive or things that are very easy to introduce into a patient's routine. For example, some of the things we can do is low impact aerobics, like walking, riding a bike, walking or running in a pool often can help people with mild arthritis. Ironically, weight loss as well, at least 10% of your weight can help in a mild arthritic joint, somebody that's got pain that comes and goes. Unfortunately, some people that have arthritis, it's severe enough that walking or losing weight is really hard because their activity is limited quite a bit. So when people that they can't do those things, typically we'll try things like ibuprofen or naproxen, which are over-the-counter anti-inflammatories. When those stop working, we have other options. One option is to give a medication inside the joint itself and try to attack this locally with a medication, typically a steroid and a numbing agent, to see if we can make that feel better. Other things that we have access to is a medication called hyaluronic acid. It's an also joint injection that we can try to help alleviate the pain. And those type of therapies typically work best in somebody that's got mild arthritis, like you can see in this knee model joint. And somebody that's got a knee joint that looks like this, most of the arthritis is gone, they have bone spurs all over the knee, and all of the other things we try fail. So we try everything first, and when that fails, typically what we need to do is go in and resurface the joint, meaning take off all the bad cartilage and put on a new surface. And that's what we typically refer to as a knee joint replacement. And a knee replacement isn't necessarily the funnest surgery to go through, and it's something that you have to prepare for, and you have quite a bit of visits with your family medicine provider and your orthopedic provider before that happens. But if there is no other option and you still want to find a way to alleviate your pain, the knee replacement is an option for you. We currently don't have any therapies that can regrow cartilage, and that's where the problem lies. If we could regrow the cartilage, quite possibly we could help people's knee pain go away, but we don't have that medical advancement now. In some areas they are doing cartilage replacements or patching certain holes in cartilage, and that is very patient specific and really determines a lot on the orthopedic surgeon that does that. But the evidence shows there's not great success with that in trying to alleviate arthritic pain. So just to review, an achy pain that lasts all day long, is worse in the morning, kind of gets a little bit better throughout the day, and then worse is at night, is typically an arthritic pain. We try everything we can as far as weight loss, exercise, oral medications, joint medications, and if at any part along the way the pain is alleviated, let's say with just water aerobics and weight loss, your pain goes away, we stop there. We don't have to do anything else, and we try to keep you pain-free for as long as we can. It could last you 10 years, it could last you 1 year. When that stops working, then we step up to the next therapy that helps, oral medications, joint injections. When all of that fails, then it's on to the knee replacement. Luckily, our medical advances are happening at record paces in this time, and every day our treatments are getting better and more improved, and it's quite exciting to be part of the fix for people that have arthritic pain, specifically in the knee joint. I'd like to thank you for joining me with this month's installation of the Ortho-Minute, and I look forward to talking with you in March.